Which brings me back to your entree to D.C. You find yourself with your family relocated to this center of the power play universe. You're taking on a new role. You get a uniform. You get a rank.
An expensive uniform. And don't at all want to say poor me, but a lot of people don't understand that, again, there are real monetary costs to public service. I had to buy all those uniforms myself.
You have to invest in them.
And my wife actually, I remember her saying, "Honey, what's this $3,000 charge on the credit card bill?" As we're moving in across the country,
yes,
and
sure.
The bills are racking up. And I said, "Well, that's my uniform." And she said, "They don't pay for that?" And I said, "No, honey, they don't pay for that." So I have the uniform still, the uniforms. There are multiple different uniforms that you have
to get. But you own them outright.
I do now, and you can better believe that my wife is going to make sure we find some use for them in the future.
Well, I mean, it's a lot of adjustments on so many fronts, but you're also thrown into a cauldron, which, while there are politics in Indiana, I know about that, in every state, every place, suddenly you're in the center of the political universe. How did you find that? You mentioned to me once before we came to the table here today about how, there's a certain relational, transactional nature of life in D.C. It doesn't matter what side of the aisle you're on. There's just this kind of way of doing things that must make it hard to navigate. Who do you trust, and who wants what, and how do I navigate? Did you find that challenging?
I found it incredibly challenging, because one of the things that people either love or hate about me is that I'm very open. I wear my emotions on my sleeve. I talk about things the way I would talk to my mother or a neighbor, very plain spoken. I don't try to go out there and act like Dr. Adams. I go out there and say, "Hey, it's Jerome, your neighbor. I went to medical school. Here's what you should know about vaccines." And I try as much as I can not to shame anyone. Again, shame, stigma, those separate us. Those push us further apart. And again, the biggest complaint that people often have about me is that I refused to condemn other people. But I've always taken the approach that if you can find something in common with people, if you can bring them into the fold, if you can build trust with them, you are going to be a lot more successful and convincing them to change their behaviors than by trying to shame them into changing their behaviors. But D.C. is a world where there's very little quarter for people who don't take sides. It's almost an instant calculation. In Indiana, people will ask you, "What town did you grow up in? Where did you go to high school?" Out in Washington, D.C., it's where do you work? And it's almost an instant assessment of which political party you are.
And then you're sized up.
And then you're sized up. And then a caricature is created of you in their mind. And so many people have this caricature of me based on a snippet that they've seen on Twitter or a blurb on CNN or just something that they heard from a friend. And that's why I appreciate this opportunity, because I try to help people understand. I grew up poor. I grew up rural. I grew up a kid with asthma. One of my proudest moments was when I stood at the White House and in between the president and the vice president of the United States and spoke to America at a press conference and held up my inhaler, because I know how stigmatized people with asthma are. I knew growing up how I was bullied because of my asthma. Even now, when you look at TV shows, one of the things that frustrates me is if they want to show a kid as being weak or nerdy, they show him pull out his inhaler.
That's the emblem. Yes.
Exactly. Yeah. And so I try to be very open about my vulnerabilities, my family's vulnerabilities, because I wanted people to understand that, hey, there's someone like you here fighting to make sure you're heard and fighting to make sure you're thought about when we're making these national policies.
And of course, as we've talked already, you came to the job already with a passion to address the opioid crisis. Mental health issues are important. I mean, those kind of weave together. They're separate issues in some contexts, but also side by side in others. And then, as you're doing your job, there is the pandemic, the COVID-19, which overtakes everything, it seems. It has to be a kind of a detour from what you dreamed of. I think about George W. Bush coming to the White House. Most people don't realize in the year 2000, he was elected to be the education president. But 9 months in, there's the 9/11 attack, and suddenly his whole trajectory is altered. In a similar way, your trajectory also was altered by this crisis, national crisis.